Hi there, this is Dr. Scott Haig. These are the post-operative shoulder exercises that we've explained to you in the hospital already, but they're here for you online just in case you've forgotten. These are for the first few days after your shoulder operation. The written instructions that you've been given at the hospital will also explain these as well. To do the first post-operative exercises is very easy. The only piece of equipment that you need is a chair. As a matter of fact, you don't even need that, but I'm going to have you do it with a chair so you don't fall down. What's the biggest complication after this kind of a shoulder operation? I'll tell you what it is. It's falling down. Stumbling or falling down, putting your arm out to catch yourself, that's the way to re-tear your cuff or to ruin your bank heart repair. So you have to be very careful about not falling down. So we're going to have you do these exercises, bracing yourself with your good hand. So here's the exercise. It's pretty easy. So first of all, you have to understand that the thing that hurts most about an arthroscopic surgery post-op usually is muscle tightness and muscle spasm. People have this to varying degrees, but the degree to which your muscles, under your own control or not, stay tight is usually the degree to which you have shoulder pain. The shoulder muscles get tight because there's some pain, but when they get tight, there's much more pain. So this exercise will help you get the muscles loosened up, and it's a very easy exercise. So let's imagine that my right shoulder has had the operation. So this is the surgical arm on the right. You're going to take your left hand and you're going to put it down on the seat of a chair, like this. And you're going to let your right arm, that's the operated arm, hang out. Put your feet comfortably apart, let your right arm hang, and just stay there until everything gets loose. At first, you're going to be like this, and you're going to not let your elbow go. Let your hand go down, open your fingers, loosen your wrist, loosen your elbow, loosen your whole arm. Now start to make circles with your right arm. The circles should be nice and wide, up to 3 feet wide is good, and they should be kind of oval, the long way going away from you. Go back and forth about 5 minutes, back and forth, slow and easy. Get your shoulder to loosen up. If you're bent over the way I'm bent over, this will keep your shoulder nice and loose. After 5 minutes of this, stand up, take your 2 thumbs, bring them around the back, and touch them together in the middle at the belt level, just like this. 1 touch and you're done. That's all you have to do, and it's really all you should do until you see me for the first post-operative visit. To review also, remember, 48 hours after the operation, you take your bandages off yourself. You can take a shower. You can get it wet then. After the shower, pat dry. There'll be 3 or 4 little spots. Put Band-Aids on those spots. Remember, don't fall down. Remember, sleep sitting up. A bag of ice, on and off, 20 minutes on, 20 minutes off. Feels pretty good for the first 2 days. It doesn't really do anything after the 48th hour, after the 2nd day, so you don't have to worry about ice after the 2nd day. You'll normally have some swelling in your arm. You'll see some bruising in your arm. Those are normal occurrences. Remember also, I don't like you to use the sling very much. You can if you really need to. Or if you're going out someplace where people are going to pat you on the shoulder. If they see you're in a sling, they won't pat you. That's fine. But otherwise, in the house especially, have that sling off. I want you to use your hand for eating, washing, brushing your teeth, writing, paperwork, silverware. You can even fold some clothes with that hand. Keep the hand of the operated shoulder busy. This is up to the first visit. I'll be seeing you in about 10 days post-op, then we're going to change exercises. So these are the exercises that you're going to be doing after you've seen me or one of my colleagues in the office for the first time. This is after your stitches have come out, and these are home exercises that are designed to have you get full range of motion of the shoulder and start to get control of the shoulder girdle muscles. The specialized equipment that you will need for this round of exercise can be found in most homes. You need a stick and a towel. We're using a wiffle bat for the stick, and we're using a towel for the towel. Now, the towel is for what we call internal rotation, which you can think of as getting your hand around your back. Again, for this exercise, let's think of it as my having had a right shoulder operation. So you're going to take the towel in your right hand, and you're going to pass it to your left hand. Your left hand is the good one. The right hand has had the operation. You're going to pull with your left hand to bring your right arm across your back. This is towel internal rotation. You can also, later on, throw the towel from the top and pull your arm up the back using the towel, like this. This is towel internal rotation also. But you're probably best off starting with this way, pulling across the back. External rotation is the opposite direction. Now for this one, you're going to use your stick. Again, it's my right arm that's had the operation. You're going to hold the stick in your hand. The key to this one is to keep your right arm close to your body. Some people will say, and this works if you need to, put something like a magazine or a towel and clamp it to your body so you don't get your arm away from your body. Hold the stick here and then push out so the arm rotates. See that movement out there? That's external rotation. And you're pushing it along using your good hand, using a stick. External rotation and internal rotation. The final exercise doesn't need any equipment. Some people do it with a stick, but it's not necessary. But this is assisted forward elevation. Again, imagine it's my right arm that's had the operation. You're going to take your two hands and link them together like this. And now you're going to use the power of your left, of your unoperated arm, and that arm is going to lift your operated arm up as high as you can. You can bring it straight up overhead like this. You won't be able to do this the first time, but the first time you'll get it maybe up to your face, and then the crown of your head, and then higher and higher. But the work is being done by the left. Now, if you're having some pain, here's a good trick, and pay attention to this. I'm going to lift up using my left. My left is working. On the way down is usually when it hurts. To make the pain go out of the right, keep on pulling up with the left and pull down with the right against it. Give yourself upward resistance with your left arm and pull down with your right. And you'll notice as you're coming down, if you're giving upward resistance with the left, the pain will be much less in the right. That's because that pulling down turns off the repaired muscles in the right shoulder. So these are phase 1 exercises that you're going to do after your first visit and not before.